Hello, everyone, and welcome to another episode of Office Hours. I'm your host, Stuart Newsome, and today we're diving into a topic that really um, becomes increasingly critical for radiology departments, and that is the role of artificial intelligence in simplifying radiology revenue management. Now, originally, we had planned to have a guest, Jason Corrigan from Script Center, with us today, but due to some unforeseen circumstances, he couldn't join us. So I've decided to pivot and bring you this important discussion that not only aligns with our original content that we were going to go over, but also addresses some of the most pressing issues in radiology today. So in this episode, we'll explore the current challenges that radiology departments face, such as handling billing complexities, managing prior authorizations, and dealing with insurance denials. We'll also discuss how AI is being used to tackle these challenges head on with real world examples that illustrate the impact AI can have on your revenue cycle management. So some of our objectives that we want to cover today is understand those key challenges in radiology revenue management, explore how AI can effectively be applied to improve those efficiencies and financial outcomes, and then we're going to take a look at some real world examples, review some case studies, if you will, that highlight the practical benefits of AI in this space. Now, as always, I know we're focusing on radiology today, but many of the things that we're going to talk about could even apply to any other specialty in certain circumstances. Now, as always, if you've been on our episodes before, we always have a Q&A session at the end, so please feel free to submit your questions throughout this episode. So with that, I'm going to dive right in. So radiology departments today are facing a landscape that is more complex and challenging than ever before. When the biggest issues that we deal with, or one of those biggest issues that we deal with, is prior authorizations. If you've been on our episodes before, you know that we speak about this issue ad nauseum. There's plenty of content that you could go back and review with our past episodes. This is an ongoing problem and one of the top denials when everyone measures what are the top denials. It's typically when we talk to clients, it's always in at least the top five, if not the top three. Now, according to a recent survey by the American Medical Association, a staggering 94% of physicians report that prior authorization lead to delays in patient care. So this isn't just an inconvenience, it's a critical issue that can have serious consequences for patient health. In fact, 24% of physicians surveyed indicated that these delays have led to adverse events, including hospitalizations, as well as even some life-threatening situations. Moreover, the administrative burden associated with prior authorization is very immense. Physicians and their staff spend an average of 12 hours per week dealing with prior authorization paperwork, and I would imagine that average exceeds in many offices and many customers that we speak to. This could be much better spent focusing on patient care, but instead it contributes to significant physician burnout. So this process can be very demanding, if you can imagine. And if you're experiencing it, which I know you are, it is very demanding. 35% of practices have been surveyed and stated that they dedicate staff to just managing prior authorizations, and that's all they do. That's their only job description. So it really has created a whole department, if you will, to try and alleviate those issues. Now, adding to these challenges are the financial pressures that radiology departments face. Reimbursement rates are declining, operating costs are rising, and making efficient revenue cycle management more important than ever. So, as you can see, those two will collide, and something's got to give here. So much so that leaders in the healthcare industry have started to emphasize the need for adopting advanced RCM technology to enhance those cash flows. They want to secure their financial health and really identify areas where improvements can be made, such as accounts receivable management as well as coding accuracy. Now, finally, there's the issue of denials. I mentioned this before. Now, in 2022 alone, $10.6 billion was spent to address improperly denied claims. This staggering number underscores the critical need for better denial management strategies. Now, I addressed this issue in a previous Office Hours episode, and you can find this on our website. It's titled Lessons from a $10.6 billion in Denied Claims. If we don't address these denials effectively, we risk significant revenue loss and increased financial strains on our departments. So let's take a moment to consider the broader context of these challenges. particularly the ongoing battle with insurers or payers. Now, there was an article that was published entitled "In Constant Battle with Insurers, Doctors Reach for Cudgel," which is, or AI. They wanted to reach for AI. This article paints a vivid picture of the difficulties physicians face when dealing with insurance companies. Physicians are spending an increasing amount of time fighting denials. For example, there's a Dr. Tariq, who is a rehabilitation specialist. In the article, he stated that he found himself spending 7 hours a week on these battles, often with little success. This is not just frustrating for the physicians, it's detriment to the patient care as well. Delays and denials can lead to severe consequences such as treatment, abandonment, as well as rehospitalization. Now, in response to these challenges, doctors are bringing to turn to AI as a tool to fight back. So payers are actually using AI, so it's only reasonable that you need to also equip yourself with the right tools and weapons, if you will, pardon the cliche, to fight back with this. So AI is being used to draft detailed evidence-based letters to insurers, which has significantly improved the success rate for appeals. For instance, there's a Dr. Chouard, who is a radiation oncologist, and he reported that using AI to craft appeals letters increased his prior authorization approval rates from 10% to 90%. Now, that's a huge turnaround. Let me repeat that. He improved it from 10% to 90%. So it stands to reason from that example alone, it could be a significant impact. It impacted him, but it also impacted industry as a whole. Radiologists face similar challenges in that where AI, we have powerful tools to navigate these denials, ensuring that our patients receive the care they need in a timely manner, while also protecting the financial health of our departments. Now, as we explore the role of AI in radiology revenue management, it's important to address some common misconceptions about AI. And AI has been around for a while. It's been the lingo that most companies will slap on their marketing materials or lead in their company names or whatnot, or their product names. But there's some myths that have surrounded this that I really want to kind of address right now. One of the biggest fears is that AI will replace human workers. The reality is that AI is designed to enhance human capabilities or augment. It's augmenting intelligence rather than artificial intelligence, not replace them. AI excels at automating routine, repetitive tasks, which frees up staff to focus on more complex, higher value activities. In radiology RCM, this means that AI can handle tasks like claim submission and processing prior authorization, allowing your staff to concentrate on optimizing workflows and improving patient outcomes. I spoke about this extensively in a previous Office Hours episodes. Yes, another Office Hours episode entitled Help Wanted, Tackling Healthcare Staffing with AI and Automation. So be sure to check that one out too. Another misconception that AI requires extensive in-house programming and development. In truth, many AI solutions are designed to integrate seamlessly with your existing systems without the need for any significant in-house expertise. These solutions are built to be user-friendly. They're also built to be scalable, making them accessible even for the smaller practices. And then finally, the last myth that I want to talk about here is that there's a belief that all automation will automatically lead to greater efficiency. Now, while automation has the potential to streamline processes, it must be implemented thoughtfully. So end-to-end automation, particularly cognitive automation, is key to achieving true efficiency. Cognitive automation can handle tasks that require reasoning and the synthesis of unstructured data, such as interpreting clinical guidelines or managing denial appeals. This level of automation is what drives real improvement in RCM. Now, speaking of cognitive automation, let's take a closer look at what this technology can do for radiology departments. Cognitive automation goes beyond simple rule-based automation by handling complex tasks that require reasoning as well as decision-making. Now, in radiology RCM, cognitive automation can be applied in several critical areas. For example, cognitive AI can be used for document interpretation. It can review clinical documents and ensure that they meet payer requirements before submission. reducing the likelihood of denials. This is particularly valuable in managing prior authorizations where ensuring that all criteria are met can be a time-consuming and error-prone process. In denial management, cognitive automation can analyze patterns in denied claims, identify root causes, and even generate appeals letters tailored to address specific denial reasons. This is not only speeds up the appeals process, but also increases the likelihood of a successful resolution, leading to faster payments as well as improved cash flow. Now let's look at some real world examples of how AI has been successful and implemented into radiology revenue management. What I'm about to share with you are cases with Infinix customers revealing how we help them utilizing our AI and automation solutions. Now, in one case, a radiology group was struggling with a significant backlog of unpaid claims, leading to delayed payments and financial strain. By implementing AI-driven billing optimization, they were able to prioritize high-value claims and reduce the AR days by 60% within 3 months. Yes, I said 60% within 3 months. This resulted in an increase in cash flow by over $500,000 and a 40% reduction in staff time spent on billing. So how would you like to have $500,000 added to your bottom line, to your revenue, to your AR, where it's actually paid, with a reduction of the time spent to achieve that of your staff time and billing? Now, another example comes from a large national radiology group that was facing a significant number of unpaid claims due to incorrect or incomplete insurance information. By leveraging an AI-driven insurance discovery tool, they identified missing insurance details and reprocessed claims, recovering $1.2 million in revenue within 6 months. Additionally, they achieved a 75% reduction in denied claims related to insurance verification and improved their success rate in identifying missing insurance details to over 90%. Now, again, those are astonishing numbers that where AI, that's just a perfect example, a true real world example of how effective the impact can be, to the tune of $1.2 million in revenue that was recovered, and also a reduction of 75% in denied claims. Absolutely outstanding. And lastly, a mobile radiology group that provides services across multiple states was dealing with a backlog of denied claims, which was causing significant financial instability. By integrating an AI-driven denial management system, they were able to automate the appeals process. They prioritized high-risk claims and also reduced their AR days by 50% within 4 months. They also recovered $800,000 in denied claims and cleared a 6-month backlog in less than 3 months, maintaining financial stability despite the operational challenges. Now, as we look to the future, there are several trends that will shape the role of AI in radiology revenue management. First of all, implementing AI and automation requires significant upfront investment, but as technology advances, these costs are expected to decrease, making AI more accessible and scalable. Radiology departments must evaluate their readiness for these investments and focus on scalable AI solutions that promise long-term efficiency gains. Also, while there is a concern that automation could displace certain roles, like I talked about earlier, the reality is that staff will evolve to focus on higher value tasks, such as analyzing denial trends or optimizing workflows. So investing in training programs that upskill employees will be crucial in this transition. Next, automation promotes standardization, which can streamline processes but may lack flexibility. The future of AI in radiology will see more customizable solutions, allowing departments to tailor workflows to their specific needs while maintaining the benefits of standardization. And then lastly, there's scalability versus complexity. As radiology departments grow and the volume of data increases, managing this complexity becomes a significant challenge. So the future AI solutions, they will actually be designed with scalability in mind, offering intuitive interfaces and seamless integration with existing systems. This means that as your department expands, the AI tools you implement will grow with you in handling larger data sets and more complex workflows without becoming unwieldy or difficult to manage. So the focus will be on simplifying the user experience, ensuring that even as the systems become more powerful, they remain accessible and easy to use for all staff members. Now, these trends highlight the dynamic nature of AI and radiology revenue management. As these technologies continue to evolve, they will offer even more opportunities for radiology departments to improve efficiencies, reduce costs, and enhance patient care. The key will be staying informed about these developments and being proactive in adopting these tools and strategies that best meet the unique needs of your practice. Now, to wrap up today's episode, we've explored how AI is not just a futuristic concept, but a present day solution that is already transforming radiology revenue management. We've discussed the challenges faced by radiology departments, such as prior authorizations, financial pressures, and denials, and how AI can address these issues effectively. Now, through real world cases, we've seen the tangible benefits of AI, from optimizing accounts receivables to recovering lost revenue and managing denied claims. And as we look to the future, it's clear that AI will continue to play a pivotal role in shaping the landscape of radiology RCM, offering solutions that are scalable, customizable, and increasingly sophisticated. So I encourage you to think about how these insights can be applied to your practice. How can AI help you overcome the challenges you're facing today? And how can you prepare for the opportunities of tomorrow? So I want to thank you for joining me today, and I hope this discussion has provided valuable insights in the role of AI in radiology revenue management. As always, I'm here to answer any questions you may have. So let's move into the Q&A section real quickly and see if there are any questions for us to answer. All right, so I do see here where there is one question. Says here, you've mentioned that AI can significantly improve the efficiency of denial management in radiology. Can you elaborate on AI specifically, how AI specifically handles the appeals process, and what kind of results radiology departments can expect from implementing such technology? Okay, that's a very excellent question. And certainly, AI enhances denial management, as we've discussed, by analyzing patterns. There's that machine learning element, if you will. There's different phases of AI. AI is kind of just this general overarching term that can be broken down in many subsets. Machine learning is one, automation is another one with RPAs. But it can actually look at common reasons for denials. So when these patterns are recognized, the AI system can then automatically generate tailored appeal letters that directly address the specific reason for each denial. So it's looking up for those patterns. You can also set up criteria within those automations, and you can dictate what it's going to do ahead of time. So this automation not only speeds up that process, but it also increases the likelihood of a successful outcome. It'll be the repetitive over and over again, and it'll follow those directions to a T. Radiology departments that have implemented AI-driven denial management solutions have reported significant reductions in their denial rates. There's also the benefit of faster resolution times or turnaround on your claims, and then ultimately improving cash flow as a result. So leveraging AI, these departments can focus more on patient care while ensuring their revenue cycle remains healthy. Let's see if there's any. We do have some time for some more, so please submit questions as you wish. So here's another one. With the growing trend towards cognitive automation, what should radiology departments prioritize when selecting AI tools for revenue cycle management? How can they ensure that these tools will be scalable, integrated well with their existing systems? Yep. So that's a problem in and of itself that I see with anything that radiology or even any practice takes on as an initiative. Whether you're migrating to another platform, a billing system, or EHR, or PAC system, or risk system, whether you're trying to transfer data, whether you're trying to implement new processes, there's a lot of things coming at you with the regulations, as mandates as well. There's all sorts of things that you have to contend with prioritizing these things can be a priority, if you will, pardon the pun. So it's no different with AI. There's a lot that you can do with AI. So my suggestion is you want to select AI tools for revenue cycle management that offer scalability, that seamless integration into your IT infrastructure. It's important to choose an AI platform that are designed to handle increasing data volumes, more complex workflows uh, as the department grows. So you want it to be sure that it grows with you. Um, Additionally, departments should look at AI tools that feature intuitive user interfaces, ensuring the technology is accessible by all staff members and they can be trainable on it. And then finally, working with vendors who offer a strong support and customization options that can help ensure that the AI solution can be tailored to meet the specific needs of that department, both now and the future. And so you definitely don't want to be trapped into a corner where now you have to start over with another project as the technology integrates. It needs to grow with you. Um, and you also need to make sure that it's easy and simple and efficient, that it's going to be seamless and able to work. So many times it's very important to pick a vendor that has the same experience. Um, like here at Infinx, we are an end RCM solution. We do denials management, we do billing, we do coding, we do audits, we do training, physician training, you name it, credentialing. There's so much that we do in the instances that our customers do as well. So we're able to build these systems because we've experienced it ourselves. So it's important to pick a vendor that has that experience, that real world experience, if you will, that understands your issues and your problems. And then also another thing that's helpful is to determine what's important and how to prioritize this is where are your biggest pain points? Where are the biggest holes in your revenue cycle? And we can do this. We have what's called a RCM health check, where we can come in and analyze the data. We can take a look at certain data points from your system and then report back to you where those certain pains are. Is it ER aging? Is it where are your top denials? Where are the biggest issues you have with your net collection rate? Um, all of this can be outlined for you, and then you can assess and help prioritize which ones to tackle first. So it's important to look at your data, have a data-driven plan that helps you assess what the problems are. And then you can have a holistic view and make an informed decision about which ones to tackle first and where AI should be handled first, rather than going in blindly and just picking something because it worked for another practice. So some of the case studies that I share with you today, those are real world experiences, but we went in with the same approach. We wanted to pinpoint what their pain points were, and we custom made for them a solution that would fit their needs that brought the results that I shared with you today. So I don't see any additional questions. So with that, I want to again thank everyone for joining us today. And if you were expecting Jason, our apologies once again. But we're very agile here at Infinix as well. So we were able to hopefully bring you this important subject that brought you great benefit. So with that, we'll hope you join us next week for another episode of Office Hours.